Hi, this is Dr. Mura again. Did you watch the first video yesterday? If you didn't, please go watch it right now. I'm serious, go watch it right now, because if you don't, you may not be able to really understand what we're going to be talking about and next. You may literally have to stop this video right now and go and watch it so that you can comprehend what we're talking about today. So yesterday, I hope it wasn't too difficult. Again, you have a chance to rewatch it so that you can understand these concepts. Today, we continue with the complication of diabetes and also the treatment that are conventionally given to diabetic patients and why they seem to miss completely the real root cause of this disease. Now, before we go there though, just remember how I was talking about the intramuscular lipid. That is the fat inside the muscles, the liver, that causing a lot of problem, clogging, inhibiting insulin to open so the sugar can come in. So there is other thing that is called, I did mention, highlight that this is from the fat that you eat, but also the fat that you wear. That is your fat, the body fat basically. And I did highlight how basically where your fat is deposited is actually of crucial importance to us than necessarily the actual fat. So that is why the waist to height ratio is very, very important. I hope you did measure that. Remember your waist circumference just between your hip bone and the rib cage, and then you just measure, just take a very deep breath, and then you just exhale, and then just take that measurement. So whatever you get in centimeters or meters, divide it with your height. It should be 0.5 or less. If it is more, then you need to see me. It shows that there is a problem and we need to deal with it. There might be some fat that need to be lost that actually may be harming you in a wrong way. Now, if you go to the body quickly, today it won't be hectic. If you can zoom in closer, please. What we have is that the spillover effect. By the way, the fat cells in your body, they never increase. The number of fat cells don't increase. What happens is just the fat cells become, they swell full of fat, right? So if you lose weight, for example, does not mean that your fat cell disappears. They just shrink. The same thing if you gain weight, doesn't mean that you have developed more fat cells. No. Your fat just swells. Now, what happens when the fat swells? What end up happening? They're going to be more fat in the liver, fat in the muscles, of course. And then what happens is when the fat cells swells, they start spilling over into the bloodstream. So you have circulating fat in your blood. That's why yesterday I did also allude to it, talking about you can actually measure the normal fat you should be having in your blood is about 100 to 500 macromole per liter. I didn't mention this, but the people that are overweight, obese, the fat is going to 600, 800. Now that continue that vicious circle of which we mentioned yesterday, continue to render the insulin resistance, which continue to worsen the problem. Now the question is, what kind of fat? Now, so we need to differentiate though. The fat that scientifically has been shown to cause more problem is what we call saturated fat. Now, saturated fat is found mainly in meat, animal food like dairy, fish, and eggs, and so forth. That fat has been linked to cause what we call lipotoxicity. So you're having these fat cells, this saturated fat, it is actually going, remember other thing that we mentioned yesterday that end up damaging the pancreatic cell. This saturated fat also literally destroy the pancreatic cells, causing more problem. Unlike the plant-based fat though, such as, by the way, this saturated fat is what we call a palmitate, that we have like oleate, which has unsaturated fat, that is we find in avocado, things like olives and so forth. They seem not to have the same effect, but saturated fat is one of the major problem. Again, this is just this week. It's just going to be a little bit of the highlight. We can go deeper into this to understand the other thing that can actually contribute to this insulin resistance, such as a pollutant, pollution, the food that I polluted, that's from the plastic. There are a whole of issues that can be actually, we go deeper into in our program. We talk about sleep and the pattern, other behavior that are affecting the whole insulin release and insulin sensitivity and resistance. But then what happened? Remember the whole event that went in yesterday. We talked about the clinical manifestation, what happened when one started having that insulin resistance. We didn't mention what happened in the kidneys. We didn't mention what happened in your brain and so forth. Now, what could be the complication? So what happened, number one, is one of the major things that happened, if you can zoom in, please. What happened is when the glucose come together with the protein or lipids, there is inflammation that takes place. That type of inflammation end up causing atherosclerosis. Now, what is atherosclerosis? Atherosclerosis is basically it's a building up of fat and cholesterol into the vessel, hardening your arterial wall, and then the vessel become harder and harder. And then you start developing this plaque. Now, this plaque that is being developed here, remember the blood flow now is no longer flowing smoothly. Now, with this, the part that is supplied, the other part here that is going to be supplied may not get a blood supply and oxygen and nutrients. And then, number one, that's where you may end up having the heart attack. This is basically what we call a myocardial infarction due to this coronary artery disease. You may have a heart attack. Other thing that may happen is because your vessels start getting disease, and then you have what we call vascular disease. When you may have just because now your blood supply to the distal part of the body is being affected. Then you may injure easily, and then the ulcers also the injuries may not heal. Other thing that happen with atherosclerosis, you've heard of of course, the stroke. Now, talking about the heart disease, by the way, we have in South Africa alone, 228 people who are dying from heart attack every single day. That's not good. And majority of these heart attacks are actually coming from diabetes, the complication of diabetes. Now, for some, if you are diabetic, you are the same as someone who had heart attack already. Now, that is how dangerous this condition can be. Now, every hour, you have about 10 people or so who are dead of stroke in South Africa. Now, the stroke that is basically your vessels in your brain with this atherosclerosis, they become hardened until they can even rupture. Other thing that can happen, erectile dysfunction in men. That's another issue. Remember, one of the things that helps the male genital organ to be erect is that the blood rushing into that organ, into the penis. Now, if those small vessels, they started getting attacked way early. If the blood cannot rush into, then you have the issue of erectile dysfunction. Blindness, cataracts. Again, the vessels in your eyes started getting disease. Now, one of the leading cause of blindness around the world is diabetes. Chronic kidney disease. I did mention about how the glucose started passing through. Not only that, there's some protein deposits that started being deposited into the glomeruli that's going to affect the kidneys, and you end up with a chronic kidney disease. Now, you may have a pain, loss of sensation, or what we call a paresthesia. That's what happens in the diabetes. One of the complication is the loss of sensation or pain. Now, the loss of sensation, if they injure themselves, they won't be able to know that they have injured themselves. Then what happens is, because there is too much glucose going on in the body anyway, when there is that injury, first they won't feel it. And then if there is injury, it won't heal quickly. And then the infection, because the glucose is one of the medium that your bacteria and other yeast infection can grow, and this is you have foot sepsis, which will often lead to limb amputations and so on. Now, there is also called a demyelination. Now, with what happened is the nerve cell have the covering. That covering of that nerve started being destroyed. When that covering of the nerve started being destroyed, the connection, that message from the stomach, from other part of the body, communicating with the brain is affected. So you may have things like stomach contraction is decreased. And that is very important to us, especially when we wanted to put you to sleep for any certain surgery. You may have, no matter how long you might have been not eating, the food may be still there in the stomach. Blood, you may have a blood retention because of that. There is what we call also orthostatic hypotension as well. If you are sitting down and suddenly raise up, if you otherwise fine, the body should just quickly correct that there is no decrease of blood rushing to the brain. But someone who's having this issue may have this orthostatic hypotension. Of course, I didn't mention about non-alcoholic fatty liver disease, because remember, the more insulin going up, the more all this problem, the liver becomes fat and fatter. And remember, the liver will compensate that long until to the point where it cannot hold anymore. And that may be too late often. Now, I didn't mention how often now they did actually the studies and autopsies to see the people who are diabetic. By the time most of the people are diagnosed with the diabetes, almost half of their beta cells are destroyed already. Why? Because the event I mentioned yesterday. Remember, the beta cell, the islets of Langerhans, they continue to secrete more insulin, trying to overcompensate. Not only that, you have amyloid deposits that depositing around the beta cell, if you remember yesterday as well, that continue destroying the beta cells. You have also saturated fat. The more you eat saturated fat, the more actually you compromise your pancreatic cell. Remember how I show you that endocrine has the endocrine part of the pancreatic gland has only 1%. That is 1%. If you continue to destroy it, before you know it, you may not be having anything anymore. Not only that, the research, the studies find out that by the time you are 20, you won't be able to make any new pancreatic beta cells anymore. So by 20, that's it. After that, if you continue to destroy them, you can literally destroy them, and then you may become insulin dependent as in type 1 diabetic. Now, what about childhood obesity? You know, when you talk about obesity, often I do talk about to my patients, if you cannot care about yourself, at least care for the young ones. With the childhood obesity, what happens is now the studies that we're talking about type 2 diabetes. Now, in childhood, we used to know juvenile diabetes, that is type 1, because that's either kids really just after birth, they got that autoimmune kind of thing that destroy pancreatic cells. But now we have type 2 diabetes in young kids, like 8-year-old kids are diabetic. Now they follow a number of kids who are type 2 diabetic to follow them 15-year study to see what will happen with these kids that are diagnosed at the age of 8. They found that by the time they reach their young adulthood, most of them, they have a limb amputation, they have blindness, they have a complication of diabetes, heart attack, and so forth. And that is so bad. Now, the childhood obesity, remember, 90% of the people that are diabetic, especially type 2, are obese. Now, if you can start, dealing with that obesity in childhood, by the way, obesity in childhood have been demonstrated. If a child is obese, it's going to decrease their life expectancy by 20 years. That's how bad if this obesity is not controlled. Now, what are the medications that we already give? It's conventional medicine. Now, and the reason why I'm highlighting on this medication is to understand, if you remember what we dealt with yesterday, you're going to see that we miss completely what will be the really root cause of this disease. Now, conventional treatment is, of course, type 1 diabetes or those that are insulin dependent, it's going to be insulin. All right. Now, I'm not going to bore you with what kind of insulin, just to know that there's a rapid acting insulin, which will work about in 15 minutes or so. And then you have intermediate insulin, acting insulin. That one will start kicking in about 30 minutes. And then you have long acting insulin, which some they last for 24 hours or 18 to 24 hours. They're very long acting. Now, quickly, again, I don't have time to go through this. I don't think it's necessary for you just to know that type 1 diabetes or those who have exhausted, their pancreatic beta cells to create insulin, they may be put on insulin. The side effect is hypoglycemia. Now, hypoglycemia means low blood sugar. Now, low blood sugar can cause your what we call tachycardia, your heart rate going up, palpitations, that feeling of doom and so forth, sweating, nausea, and seizures. Hypoglycemia can cause death. That's something not to take for granted. That's why for my patients, you rather have high sugar than have low blood sugar. And that's why God made us so beautifully that you have, remember we talked about glucagon yesterday and insulin, which work antagonistically. When one is low, other one comes up. When one is high, other one comes up. So beautiful. Now, basically the first drug to try, number one, to give basically insulin because you don't have the insulin. That's the first category. The second category is the drugs that are meant to increase insulin production. Now, this is mainly in type 2 diabetes. You do have insulin resistance, but instead of going to attack what is really causing the insulin resistance, we say, no, let's try to push so the pancreas can actually produce more insulin, which renders a pancreatic cell to be even more destroyed. These are the drugs that are like sulfonylureas, meglitinides, and so forth. These drugs, though, some of the side effects that they cause is blood sugar loss, hypoglycemia, of course, because remember, they're trying to push more insulin. So depending how much you take, it may actually cause you to have hypoglycemia. Hunger. You remember why? Because remember, when you push more insulin, the body will take out whatever blood sugar that it may be into the bloodstream. Then you have a blood hypoglycemia, and also hunger. When you feel like there's no energy, then you're gonna eat more. The more you eat with the insulin, because this insulin, these drugs will cause you to create more insulin. Insulin is gonna cause you to be hungry, and then you're gonna eat more, and then you're gonna put on weight. That's why many people that are on insulin, they're actually gaining more weight. Again, weight gain is a major issue. Other issues in this category of drugs that help your body to create more insulin, and we go into detail into specific drugs in a program. But upper respiratory tract infection, they can also cause a pancreatitis as well, just to be aware of that. Now, other category of the drugs that we use is the drugs that are now going to decrease the glucose level. Remember, first they say, okay, let's first increase insulin. Okay, if it doesn't work, okay, let's also give the drugs that can decrease the production or how much the glucose available into the bloodstream. One of the major drugs that we use is metformin, and metformin is very first line of drugs. Now, how metformin works is going basically to decrease the amount of glucose that the liver can convert putting back into the bloodstream. It's also going to decrease how much glucose you're going to absorb from your intestine. Okay, so they're trying to decrease yes, you're going to eat food, you're going to make sure the absorption is affected so that you don't absorb more energy, more glucose. That's how it works. What will be the side effect? Some of the things that happen are called lactic acidosis. It's going to cause a diarrhea because now that glucose is not being digested well, just going to be excreted because it's not well digested. It's going to cause diarrhea, nausea, vomiting, anorexia. That's another thing that it causes. It causes that bloatedness, not feeling that you want to eat food and so forth. That's metformin. And then these other drugs as well. Mainly though, these thiazolidinediones that causes weight gain, water retention. It can cause some fractures as well. All these other drugs, the major picture is because they're trying to limit how much glucose can be taken in the body. Most of the time, they will also cause hypoglycemia. They're gonna cause more weight gain in a way because now when I continue eating, it'll be as much you're not absorbing much because you feel like you're hungry. The body is not getting energy that is needed, and because that glucose is not broken down the shield, you're gonna have a diarrhea. Other ones can also cause what are called the urinary tract infection. Now, this is what happened. Now, other thing that have been shown was, okay, drugs are not working. When the drugs are not working, what about we do gastric bypass? Now, what they did is on this one, a gastric bypass. So gastric bypass, basically, that is to limit how much your stomach, basically almost 90% of your stomach is being cut off, so that you can only eat a small amount of food. In doing so, cutting the calories, then you hopefully you can decrease how much sugar is in the blood, and so far everyone will be happy. Remember, the problem with our conventional way of doing things, we just follow the symptoms, not going to the root cause of the problem. Now, with this gastric bypass, it actually took a number of people. They checked. The remission was like 83%. People with a bypass, actually they have 83% of times they manage to have a remission from diabetes. But now they study follow up to see, wait a minute. Is it because the loss, the remission, is it because of the gastric bypass, or is around what happened before the patient and after the gastric bypass? So, and that's what they did. So remember, with the surgery, just after gastric bypass, there are almost like 2 weeks of not eating right food because just post surgery, you eat very minimal, if any. So the study did, they say, okay, let's put it on. They put the same patient people who have a diabetic, they say when I put the same diet that these ones who got a gastric bypass received 2 weeks post the surgery, when I give this group the same diet just before surgery and see what happened. Now what they did, those people, the same weight and so forth, who received the same diet as those who got a gastric bypass post surgery, they lost weight and the remission was also better, the same, even better than those who got a gastric bypass. So the gastric bypass is not necessarily the treatment, rather it's the diet that I put on. So, and by the way, so you can actually eat better, eat healthier, lose weight, come remission from the type 2 diabetes without having to go the complication of surgery, such as infection, bleeding, and even death. And then just not long ago, they did these trials because seeing the complication of diabetes, the heart attack, stroke, all these complications, limb amputation, blindness, and so forth, they thought, the scientists, the research want to see, how about we combine all these different type of medication to lower the blood sugar in the blood, to see if that can be able to stop this complication. Remember, some of this complication of diabetes type 2 is because the whole surge of blood continue to circulate going around the organs that cause a problem. Now, what they did, they took about 10,000 people in this study. They combined these different classes of antidiabetics. The patient were on about 5 different types of medication, some including insulin. Now, what they found was, by doing that, do you think the patient started getting better? No. The patient started dying. Now, this study was actually published in the New England Journal of Medicine. They found that the people started dying the more this intensive blood sugar lowering medication, and the study had to be stopped because people were dying. Of course, this is not a study that you're gonna hear on your TV or newspaper, because many of the things don't come to the public. So what I'm saying is, by combining all this medication, by trying to just chase the symptoms, which is the high blood sugar, just like in a hypertension, the issue of hypertension, when you follow the symptom, the blood pressure is just the symptom. We need to go to the root cause of disease to be able to deal with it. If you just push medication, I just highlighted some few of the side effects. They end up causing dying, causing all these side effects, not dealing with the real root cause. Now, I just mentioned this so that you have a bigger picture of how we treat diabetes and why. By the way, not only that, this medication are going to be just holding on symptoms, and the side effects continue to happen. Not only that, the complication continue to kick in, and you end up literally dying from the complication of diabetes, if not the side effects. So remember, what you're trying to do, we're trying to find what really works, not only prolonging the misery, not only keeping you a little bit longer while you're suffering, but rather how can we deal with the root cause of the problem. So I hope it was a little bit clear. I don't want to take long today, but I wanted to give you overview how we treated this condition and why it seem not to work. And the more medication has side effects that can be very, very detrimental. I hope this it's very, very clear. And please, the complication of diabetes are very, very serious. And if you have loved ones, if you have kids, start dealing with this issue while it's still early. And we want to talk about what can be done from tomorrow. We start now going to the solutions. I've been talking about more the problem, but we have to understand the problem before we can deal with the solution. So we know the drugs briefly how they work, and they may not give you the solution we want. But what about type of diet? Tomorrow, we want to start with the diet. What about keto diet? What about low carb diet? What about decreasing amount of calories that you eat? That has that been shown to be able to help in diabetes or not? So don't miss it tomorrow. But please, if you have missed yesterday, please watch it to understand the context of today. You need to watch this today again. Again, ask questions. Any comment is very, very welcome. Tomorrow, we started opening up. We started giving you the solution. Again, if you wouldn't have a journey VIP, why not? That's where we start with you, practically taking you hand by hand to be able to show what you can start doing. You don't have to wait after the whole 5-day challenge is finished to start. You can literally start today. Remember, the longer you take, the more your beta cells are being destroyed, and you cannot really wait. It doesn't take long to start seeing the result. Thank you so much, and we see you tomorrow.